So hello and welcome to Wednesday Weekly, your bite-sized briefing webinar, a collaboration between Action Together, the voluntary community and faith sector and the public sector. It's my pleasure to welcome you to this episode of our Cost of Living Crisis Series. Action Together are working with Oldham Council to welcome you every Wednesday between now and the end of May to hear from the services and organisations that are working alongside you in Oldham, delivering critical help to support our Oldham residents through the cost of living crisis. So without further ado, I'm really pleased to hand you over to Moria and Clare, who will be taking us from here. Over to you, ladies.
Thank you, Gemma. Hello everybody, my name's Clare and I work as part of the homeless team. I'm one of the senior housing needs officers, and this is my colleague Moira, who also works on the same team. We're going to start off by giving you a brief overview of the services that we have at the moment, and we're going to give you a whistle-top tour of the services that we do in the homeless team in our borough. So we have the rough sleeping definition that we're going to cover, data and insights, Oldham ending rough sleeping plan, the rough sleeping initiative, accommodation for ex-offenders, a bed every night, and how to support someone sleeping rough, and questions and answers. Next slide, please, Gemma. So the rough sleeping definition is defined as the following. People sleeping about to bed down, so sitting in or standing near their bedding, or actually bedded down in the open air, such as on the streets, in tents, doorways, parks, bus shelters or encampments. People in buildings or other places not designed for habitation, such as stairwells, barns, sheds, car parks, cars, derelict boats, stations or bashes. The reason we look at these definitions of rough sleeping is because, as we often see in busy town centres, a lot of people begging, and people's sometimes presumption of that is that they are also rough sleeping. And so this definition helps us be able to target the support to the people that really need it. Next slide, please, Gemma. So this is the graph, and it tells you about the extent of rough sleeping in our borough. The green line above at the top is the figures showing what are found during the month. And we see this line as the more accurate view of what rough sleeping is like in our borough. As you can see, sometimes it peaks and troughs, and that kind of shows a reflection of how transient communities move between different areas and different boroughs. The red line at the bottom is the single night out figure, and although the rough sleepers coordinators and RSI staff go out and regularly in the month, how many nights is it in a month, Moira?
14 out of every 28 days they're out actually trying to actively engage rough sleepers on the streets.
And in between those, they do facilitate counts on certain nights, and that's so that we get accurate data for our borough. Next slide, please, Gemma. So this now takes us on to the ending rough sleeping plan. So every local authority up and down the country has been asked by central government to provide a plan of ending rough sleeping in their borough. The plan consists of 4 areas. So we have prevention, which stops people from sleeping rough for the first time. Intervention, support those currently sleeping rough to move on off the streets. Recovery, so this again is support those who have slept rough to ensure that they do not return to the streets, and there's some sort of sustainability attached to that. A system support, so embedded change and monitoring progress. We're going to go through each of these areas in more details and give you examples of how we put these 4 steps into practice in the Oldham Borough. So the first step we're going to look at is prevention and the RSI team. So we focus on preventing people from rough sleeping for the first time. We have a discharge pathway prevention officer working with 3 cohorts. So that's the hospital discharges, the households given notice from the Home Office accommodation, also more commonly known as NAS leavers, and prison leavers. These 3 areas have been identified as particular areas of more need to stop people going going from hospital and returning to the streets, and for instance for prison leavers to stop them on when they are released going onto the streets, and there's a likelihood of reoffending, and in hospitals re-hospital admission or bed blocking. We look at upstreaming of the RSI service from outreach to inreach, and what this means is that although RSI traditionally work with people who are already on the streets, when we're talking about inreach, we're looking at people that are in high risk form of accommodation. That may be that they're regularly rough sleeping, moving from one place to another, and also people that are at risk or have lost many tenancies due to differences in challenging behaviour that may be difficult to be managed in that community. So these are things that we are looking at for the future. Next slide, please, Gemma.
Okay, so another other work around prevention is the Accommodation for Ex-Offenders programme. Essentially, this is a programme to support ex-offenders into private rented sector tenancies via various incentives. This was launched by DLUC, and areas of high need, which Oldham was identified as being one, were invited to submit bids. The idea is that people will have a pathway which complements the Ministry of Justice Community Accommodation Service, or CAS3. So people identified coming out of prison or bail or approved premises with no accommodation to go to can be put through to CAS3 accommodation. That's Ministry of Justice funded accommodation. There are 10 units of which in Oldham, 2 of which have been identified as for females. And then from that pathway, an individual will get up to 12 weeks in that CAS3 accommodation. And then we look at whether or not we can move them through the Accommodation for Ex-Offenders bond into their actual own private rented sector tenancy. Next slide, please, Gemma. So just some statistics around the Accommodation for Ex-Offenders. 53% of all those who have slept rough have been in prison. Ex-offenders certainly find it more challenging to secure private sector tenancies. And this is just an idea of demand on the Housing Options Service. So if you look at referrals from prisons and probation services, we had originally projected the figure for 2022-23. That was actually exceeded, and it actually ended up being around 366 referrals through for housing options advice and support. Next slide, please, Gemma. So we were successful in our bid, and we proceeded to launch the scheme in June 2021. We had a target to deliver 25 private sector tenancies for this cohort. We exceeded that target. The programme was extended by DLUC for a further 6 months, mainly due to other local authorities not being able to mobilise as quickly. That gave us an opportunity to submit a funding request for a further 8 tenancies, of which we are on track to have had delivered, or if not, we're certainly very close to delivering that target of 33 tenancies. And in addition to that, on the back of this success, we've already secured funding for 2023 to 25 with an additional target of 70 tenancies to achieve for this group of people. So just in terms of criteria and referral routes, basically it's for adults with a history of offending, any gender, 18 plus. They must be assessed as being ready to take on a short hold tenancy, and they can be homeless or at risk of homelessness due to moving on from, for example, CAS3 approved premises or bail accommodation, or they've got insecurity of tenure and have served a custodial sentence within the last 12 months. So they could be lodging with friends, they could be in a hostel, night shelter, but they must have done a custodial sentence within the last 12 months. Additional criteria, they need to be likely as not having been assessed as priority need. Obviously, well, maybe not obvious to most people, but the local authority is only required to accommodate those people as being assessed as priority needs. So this is a route for those individuals that would otherwise not be accommodated. And they must have an entitlement to housing element of universal credit or be in low paid employment, without which the accommodation routes would be unaffordable to them. And this is just to give you an idea of the standard and type of accommodation that we are securing for our ex-offenders in Oldham. We do have a really high standard of accommodation, and we thought that it'd be useful to share that with anyone that was watching. And then finally, how to access. This has changed already, I'm afraid, since we've done it, but it is important that the person is referred to the Housing Options and Advice Service, and that's by completing a duty to refer via the portal and completing a bond referral form. Robin has recently advised that she's leaving Oldham Council, but we will circulate a Housing Options generic email address that those referrals can be sent to.
So we're on to intervention now, which is the next step in the rough sleeping, ending rough sleeping plan. So when we're looking at intervention, we're looking at how we can get in and try and target the groups and look at what we can do to try and fix the problems. So the first step is supporting those currently sleeping rough to move on off the streets. We have an RSI project officer coordinating the intelligence and the referrals. We have 2 outreach officers that work on the RSI project who support rough sleepers in the community and respond to reported sightings. We have an RSI navigator who support the entrenched cohort of individuals. So this is a key group of individuals where we have seen that they have been frequently rough sleeping over a period of time, and that RSI navigator stays with them through their journey into ABEN and also into their own tenancy, and that's to help with sustainment as well, so that we don't get them having this revolving door and coming back around again into the system. Next slide, please. Shaping RSI services. So we have a value of lived experience and in meaningful engagement, and what this means is that there is now a big push with many services for people to have people with lived experience within their teams. Within the RSI service in Oldham, we have several individuals who've had lived experience. Some of them have been homeless before, some of them have been recovering addicts before as well. This means that they are able to reach in and get into the nitty-gritty of how we can try and support somebody, and they're coming from a different place, and that's also added into the wider team within the RSI team. There's also consultation and shaping services via steering groups. So there's a regular steering group where key partnering agencies attend together, and this is a bit of a soundboard where ideas are bounced off different services. It's a really positive place where we're bringing ideas and looking at change, and it's also where feedback comes from the service group that we're working with. And from that steering group, the move on support officer role, which we've mentioned below, is what came out of that, and that there was a requirement for us to have a move on support officer dedicated to people that are in the bed every night, the ABEN, in Oldham, to help them move on specifically from there. This also helped with myth busting around COVID vaccinations as well. So the team fed back and found out why the rough sleepers were not using and accessing the vaccinations, and they provided some very simple and visual documentation that myth busted, and that was it's one of the things that they're rolling out nationally for people to do that out there when we've gone and had a look and been in different forums. But that was really helpful, and the uptake for vaccinations after that massively increased within that core group. Housing Options RSI Hub every Wednesday also came out of us trying to shape services from service user feedback. So a service user coming into the Civic who has experienced trauma or has a bad experience of being within the civic before. It's a very noisy environment. It's a very open environment. So if somebody's suffering from any mental health problems, any paranoia, it's very overwhelming for that person to come into the civic centre. So what happened, Moira kind of took that feedback back, and we had a shop, didn't we? And Moira set up a lovely shop where they can kind of come in. It's a bit of a drop-in, but we make an appointment for them. We can bring other services there as well. So if we did need to have the allocations team there to look at the housing register or the homeless officer, we can do, but it's a very relaxed environment, and it's with people and workers that they trust and know. Vaccinations via homeless friendly in ABEN is another area we looked at as well, because this setting is easy. A lot of people really like the support that they've received at ABEN. They often like to go back there for further support. So setting up the vaccinations via homeless friendly in ABEN was a really successful project as well.
I think we actually ended up being on Sky News for that, as being the first in the country to vaccinate our rough sleepers. So
well done. Well done to our Oldham team. That's what we like to do. Is it still me? Oh, is it me? Yeah. Okay, sorry, Gemma. Intervention and a bed every night. So a bed every night is our ABEN, which you will have heard me mention a few times throughout this presentation already. And how does this look in practice? It is an emergency accommodation for rough sleepers. It's traditionally what we would have referred to as a night shelter, although it is not like a night shelter now. It is more of an assessment centre for people that are rough sleeping. It's 22 beds plus one emergency sit-up space. We have 6 beds for people with no recourse to public funds. We are support is commissioned by the DePaul service, who provide reflective and trauma-informed support for the individuals within the scheme. The RSI Move On Support Officer role is co-located on the site and focus on securing sustainable and permanent move-on accommodation options. There is no direct access and there is a waiting list for vacancies, but we are now also considering people that are at risk, because we have been able to move people on quite quickly. So just for a visual, so you can see what the accommodation looks like, the top pictures are Sharples Hall. So that is the main hub of ABEN. It's a lovely project. It's all self-contained with a kitchenette and an ensuite bathroom, as well as communal kitchens on each floor. What you can see in the first picture of a Sharples is the accommodation outside. The second picture is one of the rooms, and the third picture is one of the communal kitchens. Underneath, we've got Huddersfield Road and Vicarage Street, which are smaller schemes. Vicarage Street is the NRPS scheme, which has six rooms, again ensuite with a kitchenette. And Huddersfield Road has 4 rooms, ensuite with a kitchenette. And these are again some examples of the quality of accommodation that we do provide as well, which is high quality, because we want people to feel comfortable and have a safe space to move on.
It might be worth mentioning there that NRPF, for those that don't know, is no recourse to public funds. So certain individuals may not be entitled to statutory services because they don't have eligibility, but we are in a position to offer places to 6 such individuals in Oldham.
And we have the ABEN outcomes now. We've got better outcomes now recently as well, but these are a snapshot for the period from the 1st of October to the 31st of December. So we can see that the average length of stay at that point was 101 days. It's now dropped to 87 days, which is under the 90-day target. The 13 moves in that quarter, we're now doing an average 10 moves a month, not a quarter, and 77% of the moves were positive. So 7 went into social housing, as we can see from the green figure on the pie chart there. 1 went into supported accommodation, 2 returned to family, and 1 went into statutory local authority temporary accommodation. So what that means is that that person was found to actually be in priority need and should have been offered a statutory placement. We only had 1 eviction and 1 placement ended with an individual going into custody. The types of the complexity of people's support needs within ABEN is high. That there is a high use of drugs by that particular client group due to the nature of what they've come from. So to have one eviction, that's really low, and we are the lowest borough across GM, aren't we, for the evictions. Last quarter, we were the third highest for positive move-ons out of the wider GM, and we are likely to be the second highest this quarter. Now, this quarter, we've seen sort of six moves into supported, as well as the 10 moves into social housing as well through the quarter as well. Next slide, please, Gemma.
Okay, so we're on now to the recovery stage. So this is supporting those who slept rough to ensure they don't return to rough sleeping. The government recently announced a definition of rough sleeping, that if it does occur, it's rare, it's brief, and it doesn't reoccur. So for that, we were successful in securing RSI funding for a navigator role, who performs a dual intervention and recovery, working with people through their journey until they're able to live independently or with the support of mainstream services. Now, there is possibility of stepping down from such a project as ABEN into bespoke units that are called Rough Sleepers Accommodation Programme units. These were developed in partnership after a successful funding bid with First Choice Homes. It meant that we've got 10 units of repurposed buildings in Oldham that have been done to a really high standard, as you can see there. Many of them being empty shops. So if you look at the bottom left picture, it was a former shop that's been repurposed, redeveloped, and these accommodation units are open to the entrenched rough sleeping cohort for potentially up to 3 years at a time. We have had some move through, but it's not vast. And again, this isn't instant access, direct access either. It would come through the navigator cohort predominantly, or ABEN residents. So what does the future look like for ending rough sleeping? Well, we've been asked this year to refresh our ending rough sleeping plan. We need to be refocusing on being preventative. So we aim to increase co-location with partners at the hospital, working with the Homeless Addiction Treatment Support Services, or the HATS programme, which is drug and alcohol treatment services, again, for rough sleepers. We have recommissioned now our RSI Navigator services, and we have refreshed our target priority group. Target priority group is a target priority group of entrenched rough sleepers, and that cohort will be fixed now for the next 2 years, and that navigator will stay with those individuals. We're looking at moving ABEN to a support exempt model. So that would mean the support provider taking over the running of the buildings, and we are bidding for the single homeless accommodation programme, or SHAP programme, which I think in Oldham is going to focus on young people. So how can you support rough sleepers in Oldham? Well, you can refer anyone through our online portal, the link for which is there. What is important when our teams are out trying to engage rough sleepers, we do need as much details as possible. Most importantly, a location, description maybe of what they're wearing, or where they're bedded down. In addition, we can accept referrals via Street Link. It's generally members of the public that would use that portal, and these are all sent directly through to our RSI project officer to action. I have put there, please note, referrals received outside working hours. So if a Street Link was done at 11, it wouldn't actually be actioned till the following day.